to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Good morning, everyone. Today I'm going to talk about Ureaplasma. Ureaplasma is a bacteria that can colonize the genital tracts. And most patients that are new that come through the office, they'll hear me talk about obtaining cervical cultures to rule out ureaplasma. And I get the question often, what is ureaplasma? Ureaplasma is a type of bacteria that does not have a cell wall and can present a problem. It is also known as an opportunistic bacteria, meaning that it can survive in the genital tract without causing any symptoms until it's out of balance or overgrows or the body's immune system is weak. Most of the times, patients don't even have any symptoms and they may not even know they have it. It has been associated with patients who have difficulty getting pregnant, especially the variant of it known as Ureaplasma urealyticum. The one that's called Ureaplasma parvum is not so much associated with infertility. It can be found in up to 15% of men who also have difficulty with infertility. When it does cause a symptom, when it overgrows or there's an imbalance of the immune system, it may cause what is called a urethritis, which is inflammation of the urethra or the tube that carries urine from your bladder out to the body, and that causes burning or irritation. Sometimes may have cause what is also known as bacterial vaginosis, bacterial vaginitis. In some patients, it's also linked to endometritis or infection of the endometrial lining of the uterus. It can be associated with prostatitis, which is an inflammation of the prostate glands. Very rarely, it's also associated with kidney stone formation. Now, for patients who have ureaplasma who are pregnant and deliver, they can infect their newborn child. And in the newborn, it can cause pneumonia, it can cause meningitis or brain injury. It can also cause lung problems or breathing problems when the babies kind of breathe it in through their lungs. If the fetus is infected before birth, during pregnancy, it can lead to premature rupture of the membranes or preterm labor. In extremely rare cases, can cause stillbirth. How is it treated? Usually a swab will detect it or a urine sample. So I made a video a few months ago about ureaplasma, and that generated a lot of questions from patients. And I want to tackle one of them today. The question that came up is, what is the ideal treatment for it? I see a lot of people have been treated and they keep getting the infection. The problem is ureaplasma is a gram-positive organism that does not have a cell wall. So it cannot be treated by antibiotics that target the cell wall of the bacteria. And that means you can't really treat it with penicillin, which works by attacking the cell wall. You need an antibiotic that works against either preventing protein replication or inhibiting DNA. It could be bactericidal, meaning kills it off, or bacteriostatic, meaning slows down the growth. So the most common antibiotics that fall in that category for ureaplasma would be what are known as the macrolide antibiotics or the fluoroquinolones. The most common one usually used to treat it is doxycycline. Um, can you use azithromycin? You have to be a little careful. The problem is this bacteria is very, very smart, has its own internal AI, and it's highly resistant to a lot of the antibiotics out there. So if you look at the resistant profile, there was a study done in China actually, where they studied 163,000 patients. Um, over a span of about 5 years. And they found that doxycycline, and there's another one called pristinomycin, which I don't know we have here, um, maintained a very low resistance profile. And then as you start to go up higher, such antibiotics such as azithromycin, clarithromycin, erythromycin, ofloxacin, ciprofloxacin, very, very, very high resistance rate. Ciprofloxacin, which is a very good antibiotic, is a fluoroquinolone. There's a lot of resistance by the bacteria to ciprofloxacin, as well as ofloxacin. So I really wouldn't use those as a first line of treatment. The bacteria is still sensitive some to moxifloxacin. You could use that, but you have to make sure you really want to use that because it does have some side effects, such as what is known as a QT prolongation in your EKG. It can cause tendon rupture and may damage cartilage if given to children. So I don't know if I would give it to children. Now, one of the problems is people treated this thing with standard azithromycin, like a Z-Pak. That's the best way to start antibiotic resistance because that's just not going to cut it. So resistance to azithromycin shut up. So it doesn't really work as well unless you use it in combination. I like to treat with doxycycline, and I usually start with 10 days of it, not 7. Remember, if you're going to treat it well. Otherwise, you could deviate it into being a resistant bug. And then if the doxycycline doesn't work, you can throw in a fluoroquinolone, such as moxifloxacin, and treat it for the standard therapy. Again, inappropriate antibiotic choice or inappropriate duration of treatment is the reason why a lot of people have resistance. So what you're seeing out there, people, is antibiotic resistance. So if you're dealing with it and it's not going away, maybe have your doctor run a sensitivity profile, get cultured, and have a sensitivity done. Anyway, thank you. This is Dr. Famua, and I hope that helps you. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famiua.